morning, everyone. Welcome to yet another episode of Health Discourse with Sakshi and Sushant. Good morning, Sushant. How are you doing today?
Morning, Sakshi, very well.
So, today our point of discussion is going to be something which is related to men's health. And if I be specific, it is related to sexual health, right? So, I think over the course of time, we have seen a lot of people talking about female infertility issues and all, and very less has been spoken about problems like erectile dysfunction among men. So, today, let us decode this whole science behind erectile dysfunction and why it happens, and going forward, what is the solution for it? A scientific solution, is that what we are talking about? So, Sushant, let us begin by my first question. Why is erectile dysfunction very prominent amongst men, specifically in men in the from the urban areas?
Okay, so if you see the figures, it has been reported that over 50% of the people, men in the age band of 40 to 70 years, have erectile dysfunction, right? And there's a deep-rooted science behind it. We have heard people saying, uh, it is linked to obesity, type 2 diabetes, hypertension, increase elevated blood pressure levels, right? And most of the interventions are either focused on some therapy or certain drugs such as Viagra, right? And we really even doctors have very minimal clue about it. They just try to shed their hands off, oh, it's because of your obesity, because of your hypertension, and blah, 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 right? So we have to first understand, you know, the basic mechanics, right? How a sexual organ works, right? So one is the basic raw material or input for sexual function to work is blood flow, right? So again, blood flow is really linked to your relaxation of your blood vessels, or what we call as vasodilation, right? And we have to understand this is done by a very important gas produced inside our body, that is nitric oxide, right? And people may not know that this is. I think I have repeated this. We had did a talk, intermediate talk on nitric oxide, but we know that it is gas produced inside our body, right? And it is actually it goes you know it is produced every millisecond, right? So essentially, your body has to constantly produce it, right? And there are two pathways how it is produced. One is, we know all there are endothelial cells lining all our blood vessels, including blood vessels and sexual organs on your kidneys and heart, everywhere, right? And there is an enzyme called nitric oxide synthase. For instance, everyone who are not coming from science background, enzyme is something which form a chemical reaction inside our body, right? So NOS is coupled with endothelial cell and it produces nitric oxide in the presence of oxygen. So our body produces L-arginine through urea cycle, right? And in the presence of oxygen, L-arginine and oxygen combine to convert into nitric oxide and citrulline, right? And this is how nitric oxide is a vasodilator. It performs various essential functions, such as it plays a key role in cellular communication, and it plays a key role in regulating blood flow, even oxygen uptake and oxygen delivery, right? So again, for people who do not know, right, and a lot of people do not know that uh, people who developed COVID, right, it was linked to deficiency of nitric oxide production, because again, hypoxia was linked to low blood oxygen saturation, and which again, uh, nitric oxide has a role to play in controlling the inflammation from spike protein, and even regulating this blood oxygen saturation, right? So it two plays a role in oxygen uptake and delivery, in blood flow, in regulating blood pressure, right? Uh, it do fend off pathogens. It is a neurotransmitter in the central nervous system, right? So there are multiple function networks. That is one pathway. And again, as we age, right, every year our production of nitric oxide falls by 10 to 12%. So by the time we reach the age of 50, our ability of NOS to produce nitric oxide reduces by 50%, right? And that's why the second pathway, which is nitric oxide, right? So it is actually uh, the microbes living in a saliva in our mouth, right? They actually when we eat green vegetables such as spinach, arugula, beetroot, there are a lot of nitrate in this, and again, this gets converted to nitrite, mixes with stomach acid, and produce nitric oxide, right? Again, this has a role to play in vasodilation, blood flow. So if we don't have right set of nitric oxide production by either of the pathways or both of the pathways, right? The blood flow is not there to sexual organ. That is what we call as erectile dysfunction because there's no blood flow, there's no erection, right? And again, for people who uh, and it is right that it is linked to so people who have type 2 diabetes or obesity or high blood pressure also have higher risk of erectile dysfunction or have erectile dysfunction, right? It is the common link is nitric oxide. So in case of obesity, right, the NOS is under stress due to production of an endotoxin called lipopolysaccharides by our gut microbiome, right? Which actually causes overexpression of an pro-inflammatory cytokine called TNF alpha, right? And others. So that is one of the reason why people who have obesity have high risk of erectile dysfunction, right? Second aspect is type 2 diabetes. Obviously, when the lot of insulin released by pancreas in response to something carbohydrates, sugar we eat, right? It actually sticks to your insulin receptors on various cells, including fat cells and muscle cells. And there's a lot of this insulin signaling happening with cascades at your NOS, right? And if all the signal is going well, NOS releases a protein called GLUT4, right, which goes to cell membrane, binds glucose and removes it from circulation by putting these glucose into the cells, and that's how your cells gets energy to work, right? So essentially, there is no nitric oxide production if there's uncoupling of endothelial cell and nitric oxide synthase. So probably you have this GLUT4 is not produced. There's high level of glucose in the bloodstream, then you have hyperinsulinemia, hyperglycemia, right? Then you have type 2 diabetes. And again, because of nitric oxide, there is no blood flow, so there is a higher risk of erectile dysfunction, right? And again, there are multiple other reasons why you have and nitric oxide deficiency, right? There is inflammation caused by gut microbiome, right? Which interferes with this, which uncouples your NOS, or there is oxidative stress again. People who eat a lot of high protein diets, such as having diets high in tyrosine and tryptophan and threonine, so probably you understand that not all amino acids are equal and it all depends upon how you metabolize the food, right? So a lot of these microbes in your gut when you're consuming excess protein converts a lot of these amino acids into toxins such as precursor and oxide sulfate, which cause oxidative stress, right? Uh, that's most of the reasons, right? So erectile dysfunction is linked to blood flow, right? And essentially, nitric oxide has a role to play in regulating your blood flow, relaxing your blood vessels, right? Even there is a two-way communication between your stress and your nitric oxide production. So nitric oxide regulates your various hormones such as cortisol and fight and flight response in case, or if you have elevated cortisol levels, it shuts down the nitric oxide production, right? And one of the important thing here I want to talk about is that, when the second pathway, the oral microbiome pathway, right, when you are consuming too much of mouthwash or your toothpaste have fluoride, it again creates an imbalance in your oral microbiome, disrupts network cell production, and that is also one of the reasons why you can have erectile dysfunction, right? So I'm sure a lot of people uh, do not know that their toothpaste has fluoride. We don't need fluoride. Fluoride is not a mineral which is found inside our body naturally, right? So when we consume too much of fluoride, it replaces hydroxyapatite, which is actually essential for various oral processes inside our body, right? Again, fluoride is a neurotoxin. It disrupts your thyroid function. So again, people who have thyroid also have a high risk of erectile dysfunction, right? So that's a basic way of how erectile dysfunction.
So that's pretty enticing to know because what happens is that uh, I mean, a lot of people think it is just type 2 diabetes or obesity, and the real reason is actually the nitric oxide production, which you mentioned, one of the pathways. And so I think with this, let us go to the next question. What what are the kind of supplements available for erectile dysfunction in the market? Because I have seen that there are a lot of over-the-counter supplements and some, I don't know, oils or what lotions or whatever ointments they're giving, right? And secondly, a lot of people have claimed that okay, there are some capsules which may work. So, and we have always heard that in India they do prescribe things like Shilajit and all that, right? As natural Ayurvedic herbs. So how relevant these are for such problems?
Waste of money. It's complete waste of money. I'll start with basic. So someone understands there is a nitroxide deficiency. So a lot of people would subscribe L-arginine, right?
Mm-hmm.
Again, L-arginine is produced inside our body, right? We don't need excess L-arginine, right? If you're taking excess L-arginine actually activates another enzyme called arginase, right? So all the arginine required for the production of nitric oxide is diverted from the NOS because arginine and NOS compete for arginine, right? So essentially, it doesn't put nitric oxide. Probably, it makes NOS produce superoxide, which causes oxidative stress, right? And again, when it is metabolized by arginine, it actually excretes out of body through urea cycle, right? So essentially, it is just waste of money. Second thing is we talk of Shilajit and ashwagandha, right? So again, ashwagandha and all these things. See, you have to understand that it is linked to blood flow, right? So whether it is ashwagandha, shilajit, or Viagra, or all these, drugs, right? So they are not nitric oxide donors. They actually depend upon nitric oxide. So to understand this, when nitric oxide is produced right inside our body, it activates an secondary messenger called cyclic GMP, right? And cyclic GMP is something which is required for vasodilation, which is a vasodilator, right? It relaxes your blood vessels, right? So the role of Viagra or any supplement is to make sure that this cyclic GMP does not break down, right? So essentially, if you don't have nitric oxide production, you don't have cyclic GMP activation. So for the substrate which is required for Viagra or any supplement to work, right, is not there, so it is not going to work, right? So essentially, in simple words, nitric oxide, if you don't have nitric oxide, probably taking any much of Viagra is not going to help because it's not going to improve your blood flow, right? Uh, and in simple words, nitric oxide switch on the button, and Viagra keeps the button on, right? So then you will have larger erection for 3 years, 4 hours, 3 hours, 4 hours, right? you will have headache and anxiety and a lot of these side effects, right? So these all are side effects. These all do not address the underlying cause, which is the blood flow, which is production of nitric oxide inside our body, whether it is oral microbiome or it is the NOS pathway, right? Otherwise, so when both of the pathways stop working, right? When your age, that's why I mentioned 40 to 70 years, right? Even younger population may not have such issues because again, oral microbiome is working and provided they are eating the right set of foods, they are actually eating a lot of green vegetables. They're not taking mouthwashes, they're not
Not,
taking.
I'll tell you something. When we talk about younger population here, you'll mostly find them at, food courts of some malls and, popular places like McDonald's or Burger King or whatever. So
So that
with
so they
that, with
told.
that, I'm guessing that younger population is hell bent towards fast foods right now, right?
Mhm.
Instead of, and which is why initially in the question I mentioned urban population. In
Mhm.
rural, you would not really see that. Yes, there are some people who might have an impaired this thing, but I think mostly what we have seen that in the urban population and sometimes even young in the 30s, right? They also suffer through these things. So what are the lifestyle factors involved in that in this thing?
See, you have to see first thing is that uh, both pathways you have to consider. First pathway is the nitrogen synthase pathway. Again, if you have a lot of consuming high protein diets, specifically I'm mentioning tyrosine, tryptophan, right? So people say eat a lot of protein, right? But the point is, you have to understand it is not what you eat, it is how it is metabolized by your microbiome, whether it is oral or gut, because 99% of genes expressed in your body are microbial, 57% of the cells are microbial, right? So you have to consider the biological impact of the microbial function, the downstream impact of the microbial pathways, right? So if you are consuming too much of protein, these certain microbes would convert sponge and tyrosine into picrosol, right? Which again causes chronic kidney disease, right? Which causes oxidative stress, right? Similarly, indoxyl sulfate is a byproduct of microbes eating tryptophan. Again, tryptophan do produce indole acetic acid, propionic acid, which is beneficial, which helps in regulating your satiety, right? But depends upon what specific microbes are active, what they are doing with this particular amino acid. So for some people, tryptophan may produce indoxyl propionic acid, indole propionic acid, sorry. And for some, it will produce indole derivatives, such as indoxyl derivatives, such as indoxyl sulfate, which causes oxidative stress, right? Again, inflammation. It could be through, I mentioned about lipopolysaccharides. So saccharides are something related to sugar, right? Polysaccharides are multiple molecules of sugar, right? Again, you're consuming too much of sugar, too much of processed foods, carbs, white bread, right? All these processed wheat flours, right? All these spikes, your activate your certain, microbes which produces lipopolysaccharides. It leads to adiposity, right? It causes weight gain. This causes inflammation, right? TMAO again a byproduct of eating too much of choline and L-carnitine, right? Which is again something which spikes insulin. So these are the factors which causes endothelial dysfunction, which reduces the ability of your body to produce nitric oxide, right? So these are few things also to consider. It is not that protein is bad, right? Our body needs protein for various molecular processes, but it depends upon which amino acid, how much of it, right? So all these things is very, very precise for every individual. You can't say, let me have 100 grams or 150 grams of protein every day. That's just, there's just a wrong assumption. Second thing is, again, you're taking too much of mouthwash, right? Probably you have bad breath. Again, bad breath is linked to your oral microbiome. So if you have a lot of cruciferous vegetables, which is triggering, production of oral SOS, which triggers bad breath, right? Again, if you are thinking that the solution for bad breath is mouthwash, probably you are inviting trouble because mouthwash is it wipes, it clearly mentions kills 99% of the bacteria, right? On every, if you go to any mouthwash, you buy any mouthwash, right? And again, so mouthwash disrupts the oral microbiome, it stops the nitric oxide production. Similarly, fluoride, again, uh, see, fluoride is not biomimetic, right? Fluoride is not found inside our mouth. It is not a naturally available mineral, right? It and it is a neurotoxin. It is an antiseptic, right? And I think we discussed this, but just to brief everyone, and fluoride was added in first in municipal water supplies, right? Because few research found that it causes less cavities, one or two less cavities, right? But and it did, and doctors didn't consider that it is a neurotoxin, it is antiseptic, it crosses your blood-brain barrier, so does inflammation in your brain, right? It can enter into a cellular process, right? It could replace hydroxyapatite. Hydroxyapatite is required for calcium and a lot of remineralization inside our mouth when we eat something. So there's some multiple things when it does. So it actually causes disruption if your oral microbiome and again disruption nitric oxide production, right? Uh, so even if you're eating green vegetables like agula, spinach, uh, beetroot, if you don't have right bacteria inside your mouth active and expressing right set of genes, right? Uh, you would not have nitrate in these foods converted into nitrite, right? Again, for this to happen, you need to have the right set of microbes, right? Uh, Again, nitrate gets so what happens is that when we eat all these foods, majority of nitrate gets absorbed in bloodstream. 25% goes back to saliva. Saliva converts into nitrite, and it mixes with stomach acid and produces nitric oxide, right? And again, if you're taking a lot of PPIs, antacids, right, which for if you have acid reflux, probably it suppresses your stomach acid production, so you will not have nitric oxide production, right? And it will again one of the another risk factor for erectile dysfunction. So if you're on PPIs, you have antacids, right? Beta blockers, right? All these things are going to disrupt nitric oxide production. So so it is you have to have a lot of green vegetables in your diet with specific again. There's a lot of interaction happening in the oral and gut microbiome. So probably if you're taking a lot of spinach, if you have high oxalate or oxalate metabolism is suboptimal, probably spinach would do bad to you. It will cause kidney stones, right? So there are multiple things. You have to see multiple, even when you mention about ashwagandha, right? Again, ashwagandha, uh, for people who have high histamine intolerance, ashwagandha is bad. People, oxide metabolism, don't have right set of bacteria, metabolized oxalate, neutralizing oxalate, probably you have. Ashwagandha is bad. So it is you are taking something, assuming something, your doctor is giving something, but it may not work for erectile dysfunction. And moreover, it may also cause, kidney stones and other joint pains and back pains, right? So there you have to see at multiple aspects here, right? Again, another thing I want to add here is, you know, so there's something called organic foods, right? I'm not sure. Probably you could talk a bit about what organic food is.
So organic food, when we say organic food, it means something which is grown without any intervention of pesticides or fertilizers, which means that the soil health, mostly only manure is used, right? And vermicompost. These are some organic manures that I know of, right? So
Mm,
nowadays, what is happening that since the soil, because I've been working on I do a lot of farming, so I do know that the NPK fertilizers, which are the, like artificial fertilizers, farmers do use that in abundance because soil naturally does not have these nutrients. So nitrogen, phosphorus, potassium, NPK, right? Now, when we say organic food, so it actually means that your food should not have any traces of any fungicide, insecticide, weedicides, herbicides, or
mm, mm.
pesticides, right?
But
Now,
it is marketed differently. So everything they want to sell, they call it organic food. So why I asked this because the research came, it told that uh, nitrate in organic food is five times less than that in normal vegetables, right?
Now, what is
Again,
normal vegetables? Are you talking about those
whatever
cultivated
whatever
vegetables?
fresh vegetable, whatever available in the market, right? Not
Okay,
that
okay.
packed organic. So when you talk
Hmm.
about organic, you will go to supermarket, there will be a you know label of organic foods, right? Again,
Even if you go to organic foods, the best way to find out this organic food is go to a farmer's market. I mean, where
yeah, so farmers market is good. Farmers
farmer's
market,
market.
farmers market something you would good green vegetables, right?
Yes.
But the point is, if you are falling for this marketing gimmick and calling organic food in the supermarket, it is going to have less nitrate. Again, it all depends, as you rightly pointed out, it all depends upon your soil microbiome. It all depends on the presence of nitrogen in the soil, right? And a lot of other temperature environmental factors which do determine. So there's multiple things come, but having said that, you need to have your biological processes in place, right? Your oral microbiome should be functioning well. You should not be taking mouthwash, fluoride. You should not be taking antacids and beta blockers and a lot of these drugs, right? Uh, uh, Avoid processed foods. Avoid too much of protein unless you understand your biology, or probably if you are into bodybuilding, then you should take too much of protein, but you don't need take only that protein that can be easily absorbed in your small intestine, doesn't reach your large intestine. So you don't need too much of protein here, right? And again, blood flow is key here, right? Nitric oxide production has to be fulfilled, otherwise NOS or oral microbiome pathway, right? Both impacts your uh, facilitates your nitric oxide production, and that's where your erectile dysfunction. So again, nitric oxide production is linked to type 2 diabetes, obesity, or as I mentioned about blood flow, so it is linked to your, you know, blood pressure situation. It is linked to chronic kidney disease because, when you have this low nitric oxide production, there is a lot of high glycemic response, and there's the risk of high glucose levels inside your body, which damages your blood vessels in your kidneys, arteries in your kidney, blood vessels in your kidneys, right? And that's how chronic kidney disease is also linked to your deficient nitric oxide production, right? Bad breath. Do not, if you have bad breath, I think there are a lot of other reasons you may have bad breath, like eating a lot of tofu, paneer, right? Or maybe having a lot of cruciferous vegetables because you have certain microbes active who are converting cruciferous vegetables into hydrogen sulfide production, which is causing bad breath, right? These are the multiple reasons. So do not fall for these solutions. Avoid mouthwashes, avoid fluoride laden toothpaste, right? I personally use, I don't want to endorse a brand, but I personally use Fang. Fang is have monohydroxyapatite, doesn't have fluoride, right? That is something which you should look at, right? Look at labels. Probably it should not have fluoride, right? It should have, if it's xanthan gum is good, right? Hydroxyapatite is good. So there's a lot of these good. Some toothpaste also have polyphenols and prebiotics, and even certain herbs, which can really help, which can regulate your oral microbiome, right? So processed foods are complete no, we know that, right? Even high protein diet should be really cautious about what specific amino acid you are taking, how it is being metabolized inside the body, right? These are multiple issues. Do not take too much of allergen, and ashwagandha, shilajit, uh, Viagra, all these are waste of money if your body is not producing nitric oxide, right?
I think with this you have given us a lot of insights on the problem of erectile dysfunction, and let us conclude this talk for now. And we'll be coming up with yet another episode. Any last words, Sushant, would you like to add here?
So, there may be a lot of, so I have seen that healthcare sector is going through a very disruptive phase, but we have seen a lot of, especially in India, a lot of companies are coming up with a new category called healthcare FMCG, F&B wellness, FMCG goods, right? These supplements, probiotics, prebiotics, and all these. Even for erectile dysfunction, there are new companies coming up with supplements and some capsules, right? These all are waste of money. These are not going to help because you have to understand your biological processes. If your body is not producing nitric oxide by other of the pathways, right? Take how much of these things you can take. It is not going to happen, right?
That's totally correct. So thank you, Sushant, for such a wonderful discussion. And we are looking forward to people educating people about more such problems, health related problems, so that they can take their decisions wisely, right? And
Yeah.
so have a good day.
You too. Thank you.
Thank you.